It's 10 a.m. on Tuesday. 4 physicians are busy seeing patients here at Riverside Medical Clinic in Turtleford, yet the waiting room is empty. How did that happen? In October 2014, the Riverside Medical Clinic team took part in a 5-day Rapid Process Improvement Workshop, or RPIW, allowing them to study and improve patient and provider flow in the clinic. An RPIW brings together a team of employees, physicians, and a patient for a week to examine a problem, propose solutions, and implement sustainable changes.
My name is Musigai Sechachela. I'm one of the physicians here at the Riverside Health Complex. My role was to share the physician experience before the RPIW and really what we want, what things we would like to see happening in our clinic. So the first thing we realized was that there was a backlog of patients in the wait room, and one of the main things that was causing that was that we didn't have space, and we had rooms named after doctors. So one exam room would be for this physician, one room would be for that. And you find that sometimes if the physician is not busy and the other one is busy, the patients are just piling and piling in the wait room. It was an eye-opener to really realize how much dysfunction we had in the clinic, and it was great to see how we could deal with that.
The RPIW team came up with and tried a number of different ideas to improve patient and provider flow. Physicians and other care providers agreed to share office space, freeing up 2 rooms to be converted to patient exam rooms. Exam rooms were standardized so that all physicians and care providers could use any room, knowing the right supplies would be in the right place to provide care. Computers in each room were wall-mounted on swiveling stands, allowing care providers to maintain eye contact with the patient while reviewing information or updating the electronic medical record.
Now, whenever there's a free room, it is being used and a patient is seen, and the flow of patients has improved so much, and yeah, it's incredible.
My name is Janet Cadron. I'm an MOA for Riverside Medical Clinic. Made us really think, but once things got going, it was awesome. We never had no patients lining up in the waiting room. The doctors didn't have to come out and get patients, they were already in their rooms. We had 5 rooms to use, so we could be ahead of the doctors. They weren't waiting on us, we weren't trying to beat them. Yeah, it worked really, really well.
5S is a strategy for organizing the workplace to minimize waste of time. Having everything clean, neat, and in the proper location enhances quality and productivity by making things easier to find and problems more visible. The 5S approach, sorting, simplifying, sweeping, standardizing, and self-discipline, was used to set up the patient exam rooms in a consistent way.
So everything is standardized first. We have everything in that cabinet, and it looks like that in every room. And we have our chairs here, and we used to have a lot of clutter here of stuff that we really didn't need, so we cleared that, and that was good. And this was one of the big improvements as well. Now you see I can move this PC, and so that I can look at the patient without like I'm looking for results or anything, and I can still maintain eye contact. But previously the computers were on the wall, and if I wanted anything I'd have to have my back to the patient and talk to them, which really didn't create a good patient experience. So this is very good, and our rooms, I think they're so good. So great improvement.
Kaizen is the Japanese word for the concept of continuous improvement. Directly translated, it means good change. An RPIW is an example of a Kaizen event. However, Kaizen is a way of thinking, and the RPIW is just the start. The team knows it has the power to always look for waste and to work together to make improvements.
I'm Pat Gunther, and I'm the administrator for the North Sask Health Holdings. Well, I was a little skeptical. I'd taken some lean training. I wasn't sure how it would affect us in a positive manner. But as the process went through, we saw a good buy-in by the staff and the physicians, and I definitely was impressed with the outcome.
My name is Rhonda Zinger. I work as a clinical nurse educator under the Quality and Safety Program in Lloydminster, and I was the team lead for this RPIW in Turtleford. So coming here today, it's amazing the work that they have been able to continue with, and how they've continued to make improvements and sustain the improvements that we made during the RPIW week.
We discuss in our huddles in the morning if things aren't going right, or if we think that something could be changed to be tweaked a little bit better, and yeah, it's worked really, really well. It has just maybe brought to the forefront that just little changes can make a big difference.